Okay, so as I mentioned, this week I am at the ATSA, Association for the Treatment and Prevention of Sexual Abuse Conference in San Antonio, Texas. There is a lot of really good research that it looks like is being done. It's not completely being student research. We have some professional research here also. There's a couple pieces that I have picked out that might be of interest to kind of a broader audience, since even though, as I've said before, I am, predisposed to be talking about, criminal justice intersection with mental health issues. So today this is obviously very much geared towards that. And so here we'll talk about some of the interesting posters that might have a broader appeal for the channel, and hopefully have a chance to talk to some of the authors later on when we have our meet and greets with the authors for these posters.
Okay.
Can you just introduce yourself and just tell me a little bit about your research?
Yeah, so my name is Abigail King. I am a clinical PsyD major at Nova Southeastern University in Fort Lauderdale, and my research was a scoping literature review that looked into the relationship between female mental health providers for males who commit sexual abuse. And I really wanted to look into this as myself being a female provider. I wanted to understand the nuances that happen when it comes to treating individuals, especially when you as a clinician might be a representative of the person's victim pool when it comes to if they offend against an individual. And so being able to understand what does happen and how are we supposed to circumvent some of those issues is what I was really interested in.
So what do you think the biggest takeaway is for people who are actually working in the field, working alongside people who are in the criminal justice system? If you could give them one takeaway, what do you think they would do?
I would say the importance of support and supervision. I think there needs to be adequate understanding of what some of the drawbacks of this work can be early on in an individual's career. That way, when you are in this setting and you are hearing things that might be unsavory or hard to kind of grasp and take a hold of, that you have the ability to talk to someone who's been in the field, who's been trained, and knows how to talk to you about it and work through all the problems.
I'm looking at this one as kind of an epilogue to one of my recent videos looking at the role of trauma-informed research on individuals who are debriefing with victims in murder cases, family members of murder victims. Here they're looking at training non-police first responders in interview techniques, and certainly one of the things that they found was that there appear to be improvements in the way individuals ask questions when they receive training on rapport building when working with survivors of offenses. So certainly, again, for those of us who are working in the field and working alongside people who are not necessarily treatment providers, there is a lot of opportunity for us to consider what the role of our own training is in terms of helping our colleagues who are handling adjacent duties related to our potential work. Okay, can you introduce yourself and tell me a little bit about your poster?
Yeah, so my name is Emese Maklary. I'm a doctoral candidate with Palo Alto University in California, and right now I'm doing research on creating curriculum and treatment plans for people that have sexually offended and have been diagnosed with sexual sadism. But the way that I am building that curriculum is by doing research with people within the BDSM community that self-identify as sexual sadists and are interested in that type of sexual activity, and learning from them different coping mechanisms and different ways of engaging in that behavior consensually, and using that to then inform practices and treatment curriculum basically for those that were unable to practice consensually but are being released.
So one of the things I saw on the poster, you kind of had a line between consensual, informed decision made, BDSM practice, and
Yes.
more coercive behavior. Is there anything that you could talk about in terms of how to help clinicians understand the difference between those two?
Absolutely. So within BDSM, especially veering into the SNM or sexual sadism and masochism, it is all about power play, but also consent, right? So the person that is going to be on the receiving end, or the masochist, they are actually the ones in charge. They are the ones offering consent and continuously reaffirming different boundaries. And so what is different between legally and illegally practicing this would be seeking that consent and consistently maintaining that consent throughout the practice. So part of that is effective communication and the ability to feel confident and comfortable in having these discussions with a partner. So the way that I've kind of used that in terms of treatment practices is working with guys that have offended, are still subscribing to those sexual interests and still want to practice, but don't know how to do that without causing harm. So we do a lot of like social skills training, communication based, like how to have basically the sex you want to have while getting consent, while being safe, while not causing harm.
And if anyone, a clinician wanted to learn more about this, is there any resources you could point them towards?
Oh my goodness. I could get back to you on that in terms of resources. But I mean, overall, I think jumping in and learning about consensual sexual practices in this nature is really important. I feel like especially within the realm and the world of treating sexual abuse, a lot of clinicians are very scared to talk about this as a reality of revisiting the sexual practice because in the past it's caused harm. So I think it's really important to approach these conversations and these clients without judgment, being very open-minded and empathetic, because chances are they probably received all of that in treatment before. So if you're going to make any lasting changes, being open to learning and to hearing about this from the client, and then helping them meet those needs in the safest way possible. And I feel like that's what clinicians are most comfortable with. It's just being open to having those conversations in the first place is the kind of big step that many have to take.
So here we have a study from primarily led by Jan Willem van den Berg out of the Netherlands, looking at the relationship of understanding information about dynamic risk factors on the engagement of individuals who are in treatment. And one of the things they found is that having a self-evaluation seemed to have an effect, a positive effect in terms of engagement for these individuals. This is not necessarily a new finding. Again, at the risk of being self-promoting, when I was working for Vermont, we conducted a study looking at dynamic risk factors and how we conduct dynamic risk evaluations in treatment. So that certainly found some benefits to that, and it seems like they are finding that here as well. If I can get my focus to work. There we go. They do have, they noted that this is about to be, it's been accepted for publication, so I'm probably going to be talking about this more matter-of-factly with regards to their manuscript. I've requested a copy of that from them, but very interesting work from our friends in the Netherlands. To start off, can you tell me your name?
Hi, Boon Siang.
And can you tell me a little bit about the research project that you worked on for this?
Yeah, so basically I'm interested in whether interviewers who apply rapport-based interview, what effects it has on the treatment readiness of incarcerated male sex offenders. So very good that we found that interviewers who use rapport-based interview actually leads to an increase in treatment readiness of sex offenders. The increase is significant for those with moderate and high risk of sex offending. It's very good news for us. Yeah, because at the end of the day, we want to make sure that these individuals, they attend and complete the treatment. And if rapport-based interview helps in their treatment readiness, it increases their likelihood of attending a treatment program later. This is exactly what we want to see in prison service. Yeah.
If there was any resources that you would recommend to a provider or a clinician, are there any resources that you can recommend that would help people understand how to employ this?
I think what this research found is to focus on rapport-based skills, basically applying skills to show that you are attentive, you have a certain level of expertise, you respect the interviewee, Yeah, these are really important skills that can increase the treatment readiness.
And of course, I'm going to make a shameless plug for my own work. I'm not sure if this is going to go to publication at any time in the near future, but certainly it is great to be able to demonstrate some of the impacts of improved responsivity at our ATSA conference this year.
And that's where I'm going to leave things for this video. I want to thank all the people who are willing to be interviewed for this project, and also all the people who I wasn't able to get to talk to for bringing their work to the ATSA conference. If you do have an interest in this specialty, ATSA is a great resource for that, whether you visit their website or come to the conference. Their website is atsa.com. And in the meantime, for those of you who have watched this, please do the YouTube things with liking and subscribing, and let me know if you like this kind of content, if there's other conferences that doing this kind of thing would be good for. But in the meantime, as always, go forth and do good work. Thanks, everyone.